Today I'm going to be talking about evidence-based pharmacy practice, a fundamental framework to shape the future of pharmacy. And the reason I'm talking to you about this fundamental framework is, look at all we've been discussing, the issues about where we're headed as a profession. It's very important that we have an open conversation on how we're going to shape the profession in the future. Otherwise, we'll be forgotten. And right now, I'm here to attest to you that it's a mess in North America. They opened too many pharmacy schools, and they didn't have enough practice sites. So right now, as I speak to you, there are a lot of students who are unemployed. So there are a lot of issues that we need to discuss as we move forward, so Kenya doesn't go through the same problems. So really, the biggest deal is managing healthcare resources. So I'm sorry to say we're not in the business to make money. I hope you understand that point. So it's very important that we decide whether healthcare is a commodity or is it a benefit. So we need to change our perspective on how we develop future healthcare models. So I'm going to just quickly go over the extent of the problem in the current healthcare delivery model. Of course, healthcare costs are ever increasing. There are no optimal cost containment strategies. Healthcare utilization is also increasing. That's a good thing. So that what that tells me is that patients really value our services. But we're just charging them and charging them more and more. Healthcare is the only industry that has failed to find a mechanism where you can lower the price and still maintain quality. And that's to my point about quality. What we are seeing now is less than optimal patient care outcomes and poor patient satisfaction scores. So these are things to really think about. So I'm moving on to digital technologies. This is a solution in helping us find a way to make sure that the activities we do produce value for the patient and help control costs. So really, to define digitization, it is the integration of digital technologies to change our healthcare delivery model and make it sustainable with value-producing opportunities. As I can see, I highlighted there, sustainability and value-producing. So we're not here in the business of making money. We're here to save money in healthcare so that we can be, there in the long run. So actually, healthcare has been really slow to adopt digital technologies. Google has been on the forefront, Netflix, M-Pesa. Why are we so behind? And guess what? Insurance companies are like, you know what? We're tired of paying you guys so much money. So we're going to figure out a way to really evaluate what you're doing in your practice. And so what has happened in the insurance industry, they have moved from fee-for-service reimbursement measures to value-based reimbursement measures. So they're going to be assessing the quality of the clinical practitioner. And then what also happened, the way we conduct our business, it moved from being purely transactional, which is one way, I'll just give you the drug and you pay for it, but now it's more relational. So now the patients are expecting more from us. And in business, they talk about customer lifetime value. So you want them to keep coming back and using your service. And with digitization, the mobile apps and everything, customers are really seeing the value we bring in their lives. And then, of course, for the consumers, what actually happened is they have information on their fingertips. So if we don't style up and change and adapt, what is going to happen? The consumer is going to figure out that they have other ways of getting medical information. And our value starts, reducing. They don't see any value in anything we do because they can access it through the phone. So we have to be very careful how we shape our profession in the future, because definitely the digital technologies is really changing the landscape of a lot of things. And you can see consumer health behavior is constantly changing. And this is a good thing here for us and for many other businesses too. Data collection has been made easier because of the technology. So this is a positive thing for us, and this is actually going to segue into my next slide. So the need for data collection in pharmacy. So this is one of the solutions in trying to make sure that pharmacy is still there and is still a valuable profession. So what we have here, it's going to, once we start doing data collection, it's going to form the foundation of evidence-based practice. It's going to guide the decisions we make. It's going to justify the reimbursement of our services. It's going to create value for services rendered. And most importantly, it's going to influence health policy. And as we collect data, that is documentation. So we're going to be documenting our activities. And that's really important. So I'm going to quickly highlight, this is a theory-based model, and it's called an evidence-based model. So basically what we're doing is that we're talking about why are we making the decisions. So just to give an analogy, why did you make a left turn on the road instead of a right? Because what tradition has been happening, the doctor says just go right, but the patient doesn't question the doctor. So that's really what they were saying over here, that we need to justify why we're making those decisions. So there are three domains. This model here wants the clinical practitioner to be using the best available research evidence. They want the clinical practitioner to be looking at population characteristic needs, values, and preferences. And they want the practitioner to be able to efficiently use the resources they have. And all of this ties into the larger environment and organizational context, and that is universal health care coverage. So really the attributes of evidence-based model is data-driven decisions. We're going to be digitizing our healthcare practices. We're going to be designing population and community-based interventions. So we shouldn't be wasting our time opening hospitals in communities that don't need a hospital. So we're going to have to engage and mobilize the community. We're going to be evaluating practice and interventions. So we're going to have to come up with a way of evaluating what we do and what our peers do. And then this is one of the most important points in attaining universal healthcare coverage. We're going to be educating key health policy stakeholders. And then, of course, we have to be involved in public health and leadership. So this evidence-based model is also a leadership model. So what is happening in North America is pharmacists have just been sitting on the sideline and not being involved in public health policy, and that's a big issue. So the role of pharmacy in public health is managing medications through vigilance, cost containment, and epidemiology. We're going to be improving population health outcomes. We're going to be improving health equity and decreasing health disparities. And we're going to be shaping public health policy. So really, the key points of this new practice model is not a for-profit measure. It's not a new business model. We're saving money. It's going to focus on resource management, and as I highlighted that already, it's going to be saving money in healthcare, and truly it's a public health initiative. So we are assessing the needs of a community, and then we're going to, pretty much make sure whatever we apply in the community matches their needs. And lastly, we're also going to focus on improving healthcare delivery. So that's my information. Unfortunately, there's a lot to talk about. I'm probably going to be publishing a paper with my father. And if you have any questions, you can email me. All right, thank you.